Hello and welcome. My name is Dr. Peter. My friends call me Dr. Piro. I'm your invisible guide through medical school, and I want us to talk about M3, your third medical posting or your senior medical posting, and how it's going to go. Now, first off, the structure of the posting. M3 is a clinical posting, a purely clinical posting, and it's important to know this because your exam is going to be what we call the traditional clinical exams. Your exams can either be OSCEs, like it's going to be your final exam, that's objectively structured clinical exams, or traditionals, where you actually interact with a real patient, present your case, discuss management with you, and all this is going to be happening within the confines of the exam. That's why it's called a traditional exam. So that's the structure of the posting. Now, for M3, your final exams are already close by. So these are the source of information. What will I say? The source of knowledge is the best source of stuff I would recommend for you for M3 is this. Now, by now you'd have read many, your class materials and all that and all that. But the quickest way to an accurate, to the quickest way I would recommend to you for your stuff is Oxford Handbook of Clinical Medicine. And the reason why is because it is brief enough for you to finish on time. To go through on time, and also it is detailed enough for you to be able to hit both your MCQs and also have an appreciable amount of clinical knowledge. So that's the best go-to stuff. Of course, when you have presentation and all those kind of things, you can go for the big books like Harrison, Davidson, or Kuma and Clark. But for your reference, the first reference I'm going to give to you is Oxford Handbook of Clinical Medicine. All right, now, since your exam is a traditional exam, you need a more distilled, collection of clinical stuff. And the best handbook I've found for that is, the guide made by University of Ilorin Teaching Hospital Medical Students Association of Nigeria. It's a very interesting book that summarizes and goes straight to the point. I'm emphasizing this because your exams is going to be a traditional exam. What I mean by traditional is, and there are going to be 3 parts to the exam. There's going to be the long case, the short case, and then there's going to be an oral exam, the vival. In the long case, what you're going to be doing in the long case is you're going to actually you will clerk a patient, examine the patient, present the patient to your consultant, and discuss, management, and then other questions that can come out of that discussion. It is important to try to get to the management because you're clerking your examination as well as your management, your investigation and management are all reflected in the marking scheme of the exam. So try to be brief enough, be fast enough to be able to try to get to the management of the patient, because all those sub parts of the exams have a reflection in terms of the mark. The short case is a more unpredictable exam because it can span anywhere. Your examiner can take you. The short case is usually 3 short cases. An examiner every student is assigned to an examiner, so your examiner can take you from bed to bed in the wards and to discuss various things. It can be as simple as discuss the uses of an oxygen tank or an oxygen concentrator, or it can be discuss differentials of chronic wound ulcers in a medical ward. It can be causes of colored urine. It can be anything within the ward. So it's a more unpredictable exams. In terms of the short case. Now, the vival is more going to be specific towards emergencies, managing medical emergencies. The exam can vary around since it's a traditional exam and everybody's going to have a different clinical experience. But what you are going to expect, what you should focus and narrow down on when it comes to the vival, what you expect is management of emergencies. And all these parts of this exam are actually very well captured in that small handbook, the Guide of Clinical Medicine. And it's a good book that you should use, that I would recommend for your senior medical posting. Now, let me tell you a little bit about clerking. Of all the parts of clerking the patient, the part I want you to be very, very well familiar with is that history of presenting complaint. Everybody is going to. The other part is more of just asking the patient straight question. Where you're going to demonstrate clinical acumen is going to be the history of presenting complaint, where you're going to be either applying the 5 C's or any other method of clerkship that the complaints, the cause, that is the etiology, the cause, how it has progressed, the complications, what that has led to, and then the caregiving so far. But really focusing on that aspect of the history is where your examiner is going to pay very close attention to. When I'm inspired, I'm going to make another video which is going to discuss clerkship and even examination, so that you can have a very close interaction and know exactly how to actually examine a patient, so that you don't piss the examiner off or things like that, since it's traditional exams. Now, the vivals, as I said, is going to be orals, and it's going to be clinical management of medical emergencies. So that is what you should expect in the vival part of the exam. Now, you need to know something. This is quite important. You need to be able to present your case, even if the examiner is not going to read through your writing. If you're going to clerk during the exam, um, you're going to be presented, you're going to be given papers to take into the exam, or to write the history you have taken down. But no matter how beautiful that history is when it's written, your presentation is going to be what will determine the mark. What I'm trying to get to is this: you need to be able to know how to report cases, how to speak the medical lingo, you understand? So, and how to flow when you are presenting your case. The only way you can do this, because it's actually a skill that is learned over time, is to meet the residents to report for you. And the part that you have to be more careful about is when you get to the examination. Get a resident to report for you, and then maybe you record this and then listen to it, so that you can actually get the flow, the language, for example, in a chest examination. So get the registrar to record a perfect examination for you. This is a perfect examination where there is no anomaly, so that when there is an anomaly, you can, when you examine a patient and there's nothing significant, you follow the normal, examination, and then you flow well. And then when it comes to the system where there is the pathology, you can, go deeper and then expatiate according to your finding from your examination. So it's important to record and listen over and over to what I call the perfect case, a perfect history, a perfect examination. You understand? So it's very, very important that you do that. Now, in your traditional exams, these are the warnings. You never argue with the examiner, because examiners have walked out of students out and stood outside for the 30 minutes of their of their interaction, and then that was the end of the day for that student. And immediately an examiner walks out of you, is veto, you get a 20/50, and that's already a fail mark, no matter what you do in the other part of the exam. So never argue with the examiner or piss the examiner off enough, up to the extent of him leaving you or her leaving you in the examination. That's very important. If you are right-handed, by all means stay at the right hand side of the patient. If you are right-handed, if you are left-handed and you prefer to use your left during the examinations, then make it very bold and loud when you are coming into the exam hall. That is very, very critical, so that for your bedside mannerism. Now, when you're coming to the exam, bring your stethoscope, bring your pen touch. Don't forget, maybe your wisp of cotton wool to check for sensation, your toothpick. It's also good to come along with a measuring tape, because you don't know what you're going to find. It's also good to come along with a tuning fork, and not just coming along with all these things. It's good to know how to use them also. Of course, you will not forget your patella hammer. So again, things you must bring to the exam hall: your stethoscope, you bring a pen touch, bring a wisp of cotton wool, bring some toothpicks to be able to elicit pain sensation, bring a tuning fork, bring a measuring tape. And at least those ones are very important for you to bring into the exam hall. Some people also suggest that you bring a ruler in case you see a patient with a raised JVP, for you to measure the raised jugular venous pressure. So those are things that you must bring to the exam hall. Also, for a clinical exam, it's good to appear well. When I mean appear well, imagine you examining a patient's abdomen and then you have nails that are actually unkept. And of course, the examiner will be pissed off. Clinicians are very, very particular about the appearance of young doctors. So you might not want to dye your hair for that particular exam. And you might want to wear, you might want to appear as inconspicuous as possible. Use the official colors: black, gray, blue, white. Avoid the orange, the reds, and those kind of things. And I'm talking about your dressing, from your tie to your shoe. You should be in those conservative colors, not the louder colors. And of course, your hair should be appropriate for the situation. There's no need to talk about having a clean word coat and all those kind of things already, because I know you practice that definitely. So these are the warnings. This is the structure of the exam. This is what to expect during your clinical posting. As I said earlier, the surest source of clinical information for M3 that I'll suggest to you will be Oxford Handbook of Clinical Medicine. For those of you that might like video lectures and video lessons and learn from audiovisual sources, Osmosis is a very beautiful online medical school where you can learn everything. And even for the free version, if you want, you can subscribe to the Prime, or you can just use the videos on YouTube. But every single topic that is covered in your medicine as a whole, according to the undergraduate syllabus, is well dealt with, and the videos are short, fun, and easy to work with. I've told you about the guide handbook already, and with this you'll be able to get through. Once again, don't forget, in your short case, it might vary. It can vary from instruments in the ward to radiographs. So this is what to expect in M3 posting. There is something I personally subscribe to. There are two particular things I want to let you know, and these are just from personal experience. One, new patients are not going to be generated on your exam day. So it is important, like maybe a day or 2 days to the exam, go to the ward, the male ward and the female medical ward, and look at the cases that are there. Just the diagnosis, so that you can know what to expect in the exam. That is just easy, and you are allowed to go to the wards up to 2 days to the exam, or even up to 2 days to the exam. You can actually get to the ward and see the cases that are on the ward. That's one. Then the second recommendation is, you can practice what I call the top 6 for all the specialties. You can look at the top 3 common cases that are seen. For example, in cardiology, you want to look at systemic hypertension, you want to look at heart failure. For example, for neurology, you want to look at stroke. You want to look at the common cases that occur across all the subspecialties, so that when you're going to the exam, as they say, common things occur commonly. And when you have that kind of a straightforward case of pulmonary tuberculosis, because you are meeting a respiratory consultant, or you are not able to demonstrate, that is almost the most common case you are going to get. So you have to be able to know those things. There's going to be a video on what I call the top 6 of all the subspecialties too, and how you can go about it. That's going to be part of the other video. So if you enjoyed this, don't forget to share with your classmates, and I wish you a very wonderful clinical posting. Cheers.